Hello viewers, thank you so much for joining me on this channel. In previous videos, I have talked at length about all things related to MRCS ENT. I have talked about why you should prepare for it, who is eligible for it, how to prepare for MRCS Part A, how to prepare for MRCS ENT OSCE, how to apply for UK visa, how UK visa and Ireland visa are sort of similar if you are traveling from India with some differences. I've even made videos about the other things you need to keep in mind when you are going to the UK or Ireland to appear in MRCS ENT OSCE. You'll find links to all these videos in the description below. You'll even find links to travel videos documenting my experience in the United Kingdom and also videos related to how to prepare for English language proficiency test in case you want to go to the UK to work as a doctor. With that out of the way, I decided to start a new session called Practice with Puspen. In this session, communication skills practice sessions are recorded. I play the role of the patient. Someone appearing in MRCS ENT OSCE plays the role of the doctor. Because if you want to do well in MRCS ENT OSCE, the most difficult aspect of preparation is finding a good communication skills practice partner. And if you do not practice communication skills regularly, preferably daily, then getting a good result in MRCS ENT OSCE becomes tricky. I'm not saying it becomes impossible, but it becomes tricky because the assessment of communication skills is very rigid, and you need to be very careful when you are communicating with patients during MRCS ENT OSCE manned exam. So with that out of the way, today we are going to practice history taking. The clinical scenario is sudden hearing loss. I will play the role of the patient, and Dr. Preetha Ghosh, who will soon appear in MRCS ENT OSCE, will play the role of the doctor. Before we get into the practice session, I just want to remind the viewers that MRCS ENT consists of two parts: MRCS Part A. MRCS Part A can be attempted from the home country. India also has MRCS Part A centers. This is a multiple choice question based exam. There are two papers. Paper 1 has 180 questions, paper 2 has 120 questions, paper 1 3 hours duration, paper 2 2 hours duration. Both papers need to be attempted on the same day. There is a 1 hour gap between paper 1 and paper 2. I have made detailed videos about how to prepare for MRCS Part A. You can find links to those videos below. I passed MRCS Part A in my first attempt, and I did not need any coaching to pass MRCS Part A. I passed it in September 2022. MRCS ENT OSCE is the part you appear in once you have passed MRCS Part A. For MRCS Part A, you get 6 attempts. For MRCS ENT OSCE, you get 4 attempts, and you need to pass MRCS ENT OSCE within 7 years of passing MRCS Part A. Once you have passed MRCS ENT OSCE, which consists of manned exam and non-manned exam, for the non-manned exam, you can take it from the comfort of your own home. You can take it even from India. The manned exam, however, you need to go either to the United Kingdom or to Ireland, depending upon where the venue is. I have made a video predicting the venue of MRCS ENT OSCE going into the future, because there is a cyclical pattern of rotation of venues. It's either in Dublin or in Edinburgh or in Glasgow or in London. I'll leave a link to that video as well, so you can predict where MRCS ENT OSCE manned exam will happen in 2025 if you just know the cycle. Once you have passed MRCS ENT OSCE and you want to work as a doctor in the United Kingdom, you still have one more exam, an English language proficiency test, which if you are a doctor, I would suggest you can consider occupational English test, provided the registration authority that you are going to apply to recognizes occupational English test as one of the metrics to determine that you can speak, read, listen, and write well in English. As far as the United Kingdom General Medical Council is concerned, they do consider OET as an acceptable test, and all you need is a grade of B or better in each of the four subsections. Each of the four subtests, that is B in reading, B in listening, B in writing, B in speaking. Of course, if you get A, it's better, but you need at least B in each of these four subtests. OET does not give you an overall result. IELTS gives you an overall result, but OET has only results based on the subtests. So you need to get B or better in each of these four subtests in one setting. It's not like you can get B in reading in one setting and then C in the rest, and then you just take the rest in the subsequent attempts. That doesn't happen. In one single exam, you have to get B or better in each of the four subtests. I've made a detailed video about OET, how to pass OET in 25 days, and how to prepare for each of these subtests: reading, listening, writing, and speaking. You can find links to those videos in the description below as well. MRCS ENT OSCE consists of non-manned exam and manned exam. I've made a detailed video regarding MRCS ENT OSCE as well. I'll leave a link to that in the description below. Suffice to say, non-manned exam can be taken from the comfort of your own home. It can even be taken from India. You just need a good computer and good Wi-Fi. MRCS ENT OSCE manned exam, however, needs to be taken from either the United Kingdom or in Ireland, Dublin, depending upon where the venue is. And in the manned exam, you get communication skills and clinical examination skills. Today we will talk only about communication skills. Communication skills might appear to be easy, but you can get into trouble if you don't practice regularly. The key thing is to find a reliable practice partner and practice regularly. So in the manned exam of MRCS ENT OSCE, you can expect 3 communication skill stations. There are a total of 4 stations. You will encounter 3 communication skill stations in all likelihood. I can't guarantee it. This was my experience. I had one history taking station, one breaking bad news station, and one explanation station. Instead of explanation, you can also get obtaining informed consent. The key thing to remember is each station is of 7 minutes duration, and you can't check the time while you are actually performing the task. Sometimes the stations are composite stations where you have to take history and then obtain informed consent, or you have to take history and then perform a clinical examination. So you have to perform more than one task in that duration, the same duration, 7 minutes. Each of these stations carries 30 marks, and you are assessed by an examiner who simply watches you, observes you, does not say a thing usually, and you have to communicate with a simulated patient, basically an actor who plays the role of the patient, and you have to play the role of the doctor. So today we will practice history taking with Dr. Pritha Ghosh, who is a renowned ENT doctor. She is going to appear in MRCS ENT OSCE. Practice with Puspen has received a resounding feedback from many people, and I'm making the 3rd episode of Practice with Pushpen. This time it's history taking. The topic is sudden hearing loss, and it is featuring Dr. Pritha Ghosh as the doctor, and I will play the role of the patient. I hope you like it. So today, once again, I'm joined by Dr. Pritha Ghosh. She will soon appear in MRCS ENT OSCE, and she has very graciously agreed to practice history taking with me once again. The response to the previous practice session with Dr. Pritha Ghosh was amazing, and many of you appreciated this practice session videos, so I am making it again. So we are now in the 3rd edition of Practice with Pushpen with Dr. Pritha Ghosh. She will play the role of the doctor who will obtain history from a 40-year-old patient, in this case me, who has a complaint of sudden hearing loss in right ear. Dr. Pritha, are you ready?
Yes.
So I'll start the timer of 7 minutes, and then you'll obtain the history from me. Okay?
All right.
So your time starts now.
Hello, I'm Dr. Pritha Ghosh and I am an ENT surgeon in this hospital. Can I talk to you?
Yes, no problem.
Could you please tell me your name and date of birth, please?
My name is Tom Anderson and I am 40 years old.
How may I address you, Mr. Anderson?
You can call me Tom.
Okay, so Tom, what do you do for living?
I am a politician.
All right. So Tom, could you please tell me what more about your problem and how it has been affecting you?
So it's been very disconcerting because suddenly I woke up one day and couldn't hear anything in my right ear. So it's been really worrying. It has been 3 days now. I thought it will recover with time, but it's just the same. I'm practically not able to hear anything in my right ear. My left ear is fine though, but I'm really worried why I have this problem and it's not going away.
I can understand, Tom, that this is a very disturbing and a worrisome problem. But I assure you that we will do everything possible and see what we can do to make you feel better. Is it okay if I ask you a few more questions?
Yes, that's perfectly fine.
So, how long have you been having these complaints?
3 days.
Is it getting better?
No, no, it's terrible. I just told you it's very bad.
Okay. Is there anything that makes it better?
No, it's the same. I just can't hear anything in my right ear.
Have you noticed any kind of ear discharge?
No, there has been no ear discharge.
Is it associated with any kind of ringing sensation?
No,
Any kind of dizziness?
not that I've noticed.
Any kind of ear fullness?
Not really.
Or any earache?
No, I don't have any earache.
Did you have any kind of rash on your body just before this episode or on your face?
No, I did not have anything like that.
And did you notice any kind of, did you have any kind of head injury recently?
No,
Any kind of ear injury?
no.
Are you generally well?
Yes, I don't take any medicines now.
Okay. And have you had any kind of sudden exposure to loud noise?
Yes, now that you mentioned it, did
Yes.
happen. Yes, it did happen. You're right.
And when was that?
I think it was 4 days back.
I see. I see. Are you taking any are you chronic? Do you have any chronic medical illness like diabetes?
No, I don't take any medicines now.
All right. Have you ever undergone any kind of surgery, ear surgery?
Ear surgery? No, I haven't undergone ear surgery.
All right. Have you ever been diagnosed with any kind of cancer?
No, but are you
They
suspecting that this is cancer?
no, I am we are just trying to rule out everything that might be a possibility.
Okay,
At this moment, we are not sure, but we will do everything possible to come to a diagnosis.
okay.
And have you lost any kind of consciousness recently?
Not recently, but in the past, I my mother tells me that sometimes I used to lose consciousness as a child.
Oh, I see. That might have been very worrisome for your parents. Could you tell me more
It
about
was
it?
worrisome for me also when I came back to my consciousness. And you're right, yes, my parents were also very worried. So we did go to a few brain doctors, and
Mm-hmm.
they said they did all kinds of tests, but they could not find anything wrong with me. So later on, we discovered it was because I was not having food at proper intervals.
Oh, all right. And so, does anyone in your family has a similar history?
Similar history of hearing loss, you mean?
This, yes, 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 hearing loss.
No,
And do you drink?
I do drink occasionally, yes.
All right. And do you smoke?
No, I don't smoke at all.
All right. Thank you so much, Tom. I'll just summarize. To summarize, you have reduced sudden hearing loss in your right ear, which is there for 3 days, which occurred just after a loud noise exposure.
Yes.
Am I right?
Yes.
And you have no ear complaints at this moment, and you do not have any kind of any chronic illness.
I do have an ear
have not
complaint.
got.
I hate to interrupt you, but I do have an ear complaint. I can't hear in my right ear.
Uh, yes. Apart from that, you do not have any other
Yes.
ear complaints.
Yes, yes, yes. That's
All
correct.
right. And you have not undergone any kind of ear surgery. You have no history of head injury. And if that's all I remember,
Yes, yes, that's correct.
am I missing something?
No, I don't
All
think
right.
so.
All right. Thank you so much, Mr. Tom. And I would like to do some clinical examination to come to a better diagnosis. Is that all right with you?
Yes. So I just want to know one thing. A friend of mine also had similar complaints, and it was he was later diagnosed with brain tumors. So it's really keeping me up at night.
I understand that this is a worrisome it is a worrisome concern that you have, but at this moment we do not have a confirmed diagnosis, and we'll do everything to come to a diagnosis and help you feel better.
Yeah. Okay. Thank you so much.
Thank you, Tom.
So you finished well within 7 minutes.